Climate change has serious impacts on the safety and health of billions of workers worldwide. Workers are often the first to be exposed to the effects of climate change for longer periods and at greater intensities. Excessive heat, solar UV radiation, air pollution, extreme weather events, vector-borne diseases, and agrochemicals are just some of the hazards exacerbated by climate change that workers face. According to the latest estimates, every year over 2.4 billion workers are exposed to excessive heat at work, and around 1.6 billion workers to solar UV radiation. Air pollution is also a concern for billions of workers, particularly those that work outside. Hundreds of thousands of workers are dying from hazardous exposures aggravated by climate change. Extreme weather events are increasing, exposing workers to wildfires, flooding, and major industrial accidents. The financial implications cannot be ignored due to lost productivity, business disruptions, and damaged infrastructure. The moment is now to ensure safe and healthy work in a changing climate.
Thank you all for joining us for this incredibly important webinar on the impacts of climate change and heat stress on occupational health and safety. And you can just see how important it is from that really powerful introductory video. At NEBOSH are delighted to be joined by friends from the ILO, and I'm delighted to be joined by Dr. Manal Azzi, who will be introducing herself shortly, Dr. Andreas Flores, and Dr. Halshka Grasic. Very shortly, we'll be moving on to the really innovative and creative presentations. But just a reminder before we get into that, please submit your questions in the Q&A box that you will find. We've got so much to discuss, but we will try and get to as many questions as we can. There's also an attendee chat where you can ask and answer each other's questions as well. And there will be resources and links available at the end of this webinar. Now, without further ado, I'm going to ask our friends from the ILO to introduce themselves. Dr. Manal, can we start with you, please?
Thank you so much, Dee. It's such a pleasure to join you and all our NEBOSH friends and network on this occasion. I'm Manal Azzi. I'm the team lead for occupational safety and health at the International Labour Organization based in Geneva, and I'm joined by my colleague Halshka.
Hello, thank you very much. Pleasure to be here with all of you talking about such an important topic. My name is Halshka Grasic. I'm a technical specialist on occupational safety and health at the ILO in Geneva.
And I am Andreas Flores. I'm a professor of physiology at the University of Thessaly in Greece and a visiting professor of environmental medicine at the University of Ottawa in Canada.
Thank you all so much. We're incredibly grateful to have your expertise with us. Dr. Manal, I'll hand over to you. Thank you again.
Thank you. I think what's really important to highlight, and we're really happy that we can do this in the context of the World Day for Safety and Health at Work that happens every April, 28th April. Just yesterday, we've seen so much coverage on the issue of climate change and heat and so much global interest in the lead up to the World Day. So we're quite happy that we took the time to do some research. We have two reports coming up. The report that was launched last week on climate change and safety and health, but also one more specific on heat stress that we will be launching in a couple of months as well to complement the global report. What we've seen is there are alarming numbers globally of how the issue of climate change is impacting the safety and health of workers globally. And what we're talking about is not just the changing temperature and excessive heat in itself, but also increases in exposure to UV radiation, solar UV radiation, and the resulting deaths and millions of diseases that people are facing due to that exposure. You've also, nevertheless, all probably experienced some form of extreme weather event around you or in your region, in your country, from wildfires to hurricanes to flooding that have their own impact on the way the safety and health of our working environments. But also air pollution comes to also overlap with all of these other hazards and continues to be a key hazard for workers. Indoor and outdoor kind of pollution and air quality comes to exacerbate some of the hazards that we're seeing with the change in climate today. And some other issues we'll be discussing, of course, are the increase in certain insects and vector-borne diseases due to the changing temperatures that we're facing, and in particular sectors and regions where workers are highly exposed. Not to mention the increase in pesticide use and the different effects that chemicals that we are exposed to are having on our bodies when we are exercising effort and work in certain conditions. So it was really important for our global report on climate change and safety and health to be able to cover all of these issues. And obviously not just heat, that is the first thing that comes to mind, although the most important one, and we'll be hearing a little bit more about that from Professor Flores. But before we go there, I really wanted to share with you some of the big numbers that we've seen come out of the report. We have over 2.41 billion workers exposed to excessive heat at work every year. We're also looking at over 22 million workers suffering occupational injuries because of this excessive heat, and some 19,000 deaths. And these are alarming numbers because what we're talking about concerns more than 70% of the workforce. So it is a workplace issue. It is a worker health issue. We're seeing heat exhaustion, heat stroke, different kinds of kidney disease, cardiovascular disease, and many other health threats to our workers. So we do need to do something about that. Maybe I hand over to my colleague, Dr. Flores, to discuss more what we mean when we say heat exposure, excessive heat, heat stress, and what kind of interesting research he's been doing with his team in Greece. Dr. Flores, over to you.
Thank you, Manal. So heat stress is the excess heat that our body absorbs when we are working in a hot environment, and it can happen because of any of the following three factors acting either alone or in combination. So the first factor, and the most typical one, the one that most of us are familiar with, is being exposed to heat from the environment, whether it is because of high temperature or humidity, or working under the sun, or working in a very low wind. But there are two other factors that often we forget. The first one is the added heat that we absorb due to wearing protective clothing, and also the heat that's being produced in our body when we are doing intense work. So it's important to consider all these factors when we are either trying to protect ourselves, trying to protect our fellow workers, but also when we are designing strategies at the level of the organization or even at the national level to protect workers from heat stress. Now, some of the things that we need to take into account, since I was just referring to what we can do, is we certainly need to consider the amount of time that workers are exposed to heat. So trying to, first of all, quantify the level of heat stress, and then trying to devise ways to use the hierarchy of controls that ILO so amazingly has put out there for several years now, to use the hierarchy of controls to minimize the exposure, substitute it if possible, and overall, save workers from this very important physical hazard. These, for example, some examples for this include hydration strategies. So use white water, first of all, accessible water. Often we see in workplaces, workers don't have readily accessible water to them. They have to walk for a long time to go and get water, or often the water is not potable or it's not cold enough. So we've seen that water is very practical, economically viable, probably the best, I would say overall, the best strategy that we can use to protect workers' health. And it addresses a very important hazard, a very important health outcome, that comes from heat exposure, which is chronic kidney disease. We're still, in the science world, we're still not sure whether chronic kidney disease comes just because of heat exposure, or whether heat exposure exacerbates, so increases the risk for getting to chronic kidney disease. But certainly it is part of the puzzle. So it is important to hydrate enough when we're working in a hot environment to reduce the level